Shah here with Qure. I'm the new CMO here, and I wanted to introduce Dr. Reza Forghani. He's vice chair at University of Florida, and he directs the RAIL laboratory, that's radiomics and AI laboratory there, and he is a very well-known expert previously at McGill. Welcome.
Thank you for having me.
So, I wanted to talk to you today about AI in rural settings. So, I'm a teleradiologist by training, and teleradiology, most people don't think of it necessarily as rural, but a lot of our partnerships were with small hospitals in geographically difficult areas. Those hospitals benefited from teleradiology a lot. And so now as I move into the AI realm, I see that small hospitals that may have one radiologist or are in a rural space where they can't recruit easily a large number of radiologists like an academic center in an urban place, they could benefit from AI, right? How do you view that?
No, thank you for bringing up such an important topic. Actually, this is one of the areas that really interests me because as you mentioned, and by the way, this has both North American and global implications. So in North America, we have very large distances. And most people forget that there are rural settings where there's a significant absence of expertise. And AI is a really excellent opportunity, at least when it comes to diagnostics, to bring that expertise to them, whether it's shortage of expertise, or I would say even the top level expertise that you could get in a city, you could get right over there. There's also a global component, as you can imagine, to rural. Different countries have different pressures, and sometimes we forget that there are parts of the world where people have no access to a radiologist, right? So even though a lot of times, of course, we aim for perfection, there are parts of the world that having a 80% or 90% accuracy is far beyond what they're getting. And we should not forget that AI actually could be a real interesting way of bringing that care to those parts that otherwise would not have that level of care.
Yeah. My experience at Qure thus far is that we're able to help places that have millions of population but may have like hundreds of radiologists and that's it. So there's no way to match that. And you almost need AI, otherwise you're not going to get the interpretative accuracy. In the US, radiologists are expected to really almost be perfect, and that's very hard to do when you are in a place where you're reading MRI, mammo, MSK, etc. Do you also see value in AI helping with ChatGPT and new developments like that? Can it help reporting? Basically, take a general radiologist and make them much more subspecialized in language? Could it do that?
So I think the answer is yes. And I'll say there's two angles to that. One is that you alluded to the fact that most care is provided by general radiologists. Although I'm a subspecialized radiologist, we have to be honest, it's not realistic. And I don't think any other profession has it that only subspecialists provide all the care.
Right.
And the first opportunity I see is as the AI algorithms become more sophisticated, you can have an assistant that helps that radiologist enhance that diagnosis, get close to even expert level at a subspecialty level. Indeed, I would say some of your algorithms and some of your own preliminary data based on some of your software have suggested that AI can take a read and increase the proficiency. Then the second thing, what you said is there's all these exciting developments with generative models and large language models. In those settings, certainly, because now you can marry that improved observation into more expert level or say standardized reporting. I would say there's a third benefit there as well. One of the challenges right now, and I know in North America, is the shortage of experts, shortage of radiologists. So, this results in delays, people having to read too many. They could be a safety factor. And that combination of auto-reporting actually is something we are very interested in, the whole concept of next generation reporting, because if you can imagine, that's an area where you can gain efficiency that is non-contentious. Because if you're going to make radiologists more efficient on something that they already need to do, essentially it means the value has to be they're more efficient at the same or better safety, right? And I would say the reporting part could actually be key. Nobody wants to dictate more. And actually, ideally, you want your expert to focus on the image.
Yeah.
So that's like a great opportunity.
Those are great comments and great thoughts. I definitely agree with you that AI can be a language component for radiologists as well as a computer vision component. So here's another question. Regarding the rural space, if you're a small radiology group, do you have any thoughts? Like, who can afford AI? Like, who's going to help pay for AI to go into the small hospital setting? That's not an easy question. So
that's not an easy question, and I won't pretend to have a good answer, partly because who pays for AI is not clear. I think we need to think about it though. Like any other technology, if this is sustainable, someone has to figure that out. And maybe one way of looking at it is, where is the benefit? It may be application dependent. So for example, if you're going to make algorithms that change completely therapy and have a major therapeutic impact, I think those are areas where you could actually go seek codes like CPT codes in the United States, or similar reimbursement. If something benefits the hospital or radiologist group, mainly, how does that come? I don't have a good answer. Should the hospital pay? Should that be part? If there's a safety component, is it fair to maybe put some of that on the patient? What I think, to answer that correctly, we need to again get back, especially as the algorithms are still, I don't want to say simple, but let's be honest, the algorithms still do fairly basic tasks.
Right.
I think we need to show where the value is. For example, if we deploy something, how much of a safety value it has, how much of a efficiency value it has, that may at least let us have a relatively rational or objective discussion regarding who should pay for it.
I agree with everything you said. I also think, we're looking at things in healthcare being more equitable, right? And in terms of rural space and small radiology groups, you want them to have the same option. So I also agree that like a CPT code is equitable, right? Like a small group or a big group is going to use CPT codes. And we know that, insurers have lots of money right now, and that's not equitable necessarily. And so I agree with you. You have to look at who benefits, and if it's benefiting the patient from a safety perspective, etc., then you can look at the health system, look at the CPT codes, and maybe have some future reimbursement there. But we're so early.
Well, no, it goes back to our earlier point. You're right. Actually, AI in rural areas, it is a health equity thing, because sadly, like we discussed, some of our remote areas, you can't get care. Sometimes you can't get timely care. So you can diagnose an emergent condition and then alert someone within a system that you don't have a lot of providers. That's real value, and it actually brings health equity. I would say in things like stroke, for example, when do you transfer? If you can accelerate those transfers, you might make someone be eligible for a therapy that they would not if you have to wait another 2 hours. And in that sense, absolutely AI can bring value. And I think what our focus is, we are very interested in value, in showing and real practical value. It is very important, I believe, that future research be directed. How are we changing the impact on the patient? And I think that's the best way to be able to then convince the other policymakers and payers why they need to pay. And look, there might be even that you can actually have a business case. Like if you can prevent a certain illness, it's not only that it's better for the patient, there's actually a wanted cost impact. So by doing that through AI, that would be the kind of value model I would hope everyone would agree that it requires payment for.
Definitely. I agree with you, and I also think that what you said about other parts of the healthcare system have to improve. Communication is one of them. AI is going to help us. The other thing is like mobile technology. Radiologists like us, we've kind of ignored mobile because we're in the basement, phones don't work, etc. But other parts of the hospital, younger doctors, they're using mobile. So at Qure, I know that they're working on these things that like care coordination so that, things are followed up on. And that is actually equitable care for patients, even in the rural space. And then, like you said, with stroke, communication, getting things to doctors faster, AI can help us do that because we've been in our waiting rooms and very difficult using old technology like phone calls when, we need things done much faster because every minute we delay, patients can get hurt.
And there's also the angle to that, think about it, that can also address some of our pain points. It's better for care. At the same time, we shouldn't be, as experts, we are expensive, let's be honest. And we shouldn't spend our time on things that don't require that. So I think that's really a double hit in the sense that you get better care, but at the same time, you're actually more efficient in terms of, the care you're delivering. Also, totally agree. Ultimately, yes, we are radiologists primarily, but we are diagnosticians, right? And we are here to impact the patient trajectory. And with AI, I actually think if properly deployed, we can really go, just as radiology has been pushing the boundaries of impact. If you think many years ago when we just read x-rays versus now where the hospital operations are dependent, yes. I think really focusing on the patient trajectory and patient outcome, that's where it's going to be really good for the patient, and we will bring real value to the system and hopefully address some of these challenges that so far have not been adequately addressed.
Well, Dr. Forghani, I'm so glad that you were with us, and your insights are fantastic. I'm so glad you're a partner with Qure because we can learn a lot from you, and appreciate everything you've done.